Hello. So let's talk about sex and hormones, right? What better than post-holiday, right? No, but really, let's talk about sex, not the song. Talk about actually the benefits and also about how we can help you and your partner because something happened today that actually reminded me of the importance of something and some studies that are out there, and also the conversation I had here in the office. So, here we're early September 2020, and yes, we're treating a lot of things, especially gut-wise and immune-wise. And as always, we balance and replace hormones and keep them optimal, but also very balanced. And one of the important things in hormone replacement is quality of life, satisfaction, love, intimacy, things like this. Now, there are studies on patients, not our patients, of course, that are out there that do show that sexual intimacy and intercourse actually do have longevity benefits. People that have regular intercourse and have a regular intimate relationship actually live longer, and that's not a joke. And it's a good quality, healthy part of life. And it's good for you, okay? And obviously it can be emotionally good for you, psychologically good for you, and physically good for you. One thing that has been studied and well documented is that with intimacy, you release a hormone called oxytocin. And when oxytocin goes up, you actually improve your immune response. So you get a stronger immune system after intimacy and orgasm and sexual intercourse, and especially when there's a connection, when there's a love connection, there's more oxytocin released. So where do we come in? Where does Longevity Health Institute and me and my practitioners come in with this? Well, I had a gentleman today actually sitting right over there in that chair, and he was on a follow-up visit, and he is 69 years old, a very healthy 69-year-old. He came to us because of some erectile dysfunction. He came to us for a little bit of fatigue. And what he realized, even though he's 69, he's very healthy, he's retired, he's active, takes no medication, wants to keep it that way, but that he's lost muscle mass. And he's not looking to be big or anything like that, but to be honest, his bicep was about that big, and he got into something that we call sarcopenia, and that is muscle loss. And that does put you at risk for bone loss like osteopenia and osteoporosis, but that bothered him. And him and his wife couldn't have the best sexual encounter and relationship because of his, if you will, sexual stamina and erectile issues. So he wanted his hormones tested. Now, we took it further and we tested some cardiac things in him, which we did discover some small underlying things that we're working on so that preventatively we can help him. And we did some things with him gut and nutritionally, but hormonally he was a little bit off. Well, we talked about replacing that, and that was part of our visit today, how we can optimize his erections and improve circulation to erections and balance his hormones for obviously those benefits. But what also today was interesting that came up is that he said, sitting there, and a great guy, obviously, long marriage, 40 years plus, and he actually said, well, listen, the real deal is this, I want to have intimacy with my wife, but what's more important is, she has some discomfort, she has some vaginal dryness, she has pain with intercourse. He goes, actually, she gets some cuts and they don't heal for sometimes a few weeks. So, we both just agreed maybe this isn't the right time or the right place. So I encouraged him, listen, no offense, but we're going to put you on the back burner and you need to tell your wife, who's not a patient here, to either have her come in and see me or one of my female practitioners, and we need to do a thorough hormone evaluation of what we can do to help. Because when women get vaginal dryness and painful intercourse, that is due to the loss of estrogen locally. And the mucosal tissue dry up, the vessels become more superficial, things are drier, more painful, and there can be bleeding even with intercourse. And some are mild and some are more severe. Some actually women will report to us that actually they feel it on a day-to-day basis just with just walking and exercise and movement. And so something like this can be very bothersome. Now, lower hormones postmenopausally and the loss of estrogen, you are more prone to urinary tract infections, and you're also more prone to bladder incontinence and bladder weakness, so overactive bladder. So dealing with your hormones and treating somebody locally with estriol, particularly and estrogen, you can build the inside of the vaginal mucosal tissue and not just improve your sexual experience and not have pain and dryness, but you can limit urinary tract infections and actually reduce overactive bladder and bladder incontinence. So again, all about the hormones, and it's all about the appropriate dosing and the balance of these hormones. Now, going back to him, again, we put him on the back burner. She's more important. I said, you take a break, but going back to him. So, testosterone for him is going to help his libido and may help his erections spontaneously a little bit. But he, as I said earlier in this video, did have a little underlining calcium buildup in his coronary arteries. And, the corpus of the penis is these tiny little hair-like vessels. And if you have a little bit of underlining coronary or heart calcium plaque, if you will, blockage, even if it's a little bit, he's not having a heart attack, he doesn't have chest pain, he's in a safe zone. We're just working on reversing that and stabilizing that, okay? But we need to help his blood flow. So we're going to put him on some things that chelate or pull out, break down calcium in his arteries, and increase the nitric oxide in his vessels naturally, okay, with diet and gut health and a few supplements, and get him in a healthier model and also get his erections improving. And there's many ways to do that. The testosterone is beneficial for many other things, so we will use that and it will increase his libido, but his is more of like a combination approach, okay? Well, what is lovely and what's beautiful about this whole thing? Well, the reality is this, is not just that we've done a service and we've helped them and they can experience, a sexual encounter without pain and now intimacy and an emotional, loving connection that is very important to health, okay? But that is very important whether you're 69, 59, 49, 39, or 20. I'm telling you, it's important. It's part of life, it's part of health, it's part of connection, and it's part of being a gratified, grateful, loving individual, okay, in this world. So please consider hormone replacement, because I do believe it's the best of part of your model in keeping you well in prevention and keeping relationships good and keeping them healthy. And do it right and do it appropriately guided and make sure you're always balanced and you're tested and retested on treatment, okay? So here at Longevity Health Institute, we pride ourselves on that in a personalized approach to this as well as other medical conditions. So if you need help, give us a try. Email us anytime. And Longevity Health Institute at yahoo.com. And look us up on the web, longevityhealthinstituteinc.com, or give us a call, 248-289-6643. And we're happy to help you do telemedicine, do a consult over the phone, or come in here. We do both. But again, hormone replacement, optimizing and balancing hormones, and appreciating an intimacy and a loving connection like sex, very important, very healthy. So this is Dr. Lewerenz. Be well.